Hello all, welcome to the video cast from Pain Guru. We're going to talk about the chronic post-surgical pain, which is a part one of the lecture series, which will cover the basic aspects of chronic post-surgical pain. So let's start with the definition of chronic post-surgical pain. The ISP definition, which was described by McCrae and Davis, proposed the first definition for chronic post-surgical pain. The criteria should be the pain must develop after surgical procedure, the duration of pain should be at least 2 months, and the other causes of pain should have been excluded. So, what's the prevalence of chronic post-surgical pain? 10 to 30% of patients develop chronic post-surgical pain at 1 year. A large UK study showed 22% of patients undergoing surgery do develop chronic post-surgical pain. What are the common elective procedures which can lead to chronic post-surgical pain? These are inguinal herniorrhaphy, breast surgery, and thoracic surgery. So let's talk about the risk factors. What are the risk factors? If somebody who's got severe acute pain preoperatively, more likely to develop chronic post-surgical pain. Age is also a very important factor. Younger people are going to develop more chronic post-surgical pain as compared to old people. Psychological factors play a very important role as well. Intraoperative nerve injury is also very well linked with development of chronic post-surgical pain. So the factors which involve are surgical stress, duration, and the type of the surgery. Acute post-operative pain is also a very important factor that contributes to the development of chronic post-surgical pain. There is also a study suggesting the genetics have been very strongly involved in development of chronic post-surgical pain. So the current figure shows you the overall factors that are important in chronic post-surgical pain. On the left side of the figure, it tells you that the patients who have preoperative pain are more likely to develop chronic post-surgical pain. The other factors are also displayed on the figure, like age, psychological factors, genetics, surgical technique, and most importantly, the anesthetic technique that are involved to provide post-op pain relief have got a major impact on development of chronic post-surgical pain. A large study conducted in the population showed the following risk factors are responsible: younger age, low household income, specific comorbidities like heart failure, diabetes, lung diseases, as well as use of specific drugs preoperatively are strongly associated with development of chronic post-surgical pain. The drugs involved are pentothioxide and ACE inhibitors. Another large study showed that the type of surgical procedure also is associated with the development of chronic post-surgical pain. The open radical prostatectomies are less likely to giving rise to the chronic post-surgical pain as compared to the thoracic procedures. Conversely, open and minimally invasive major gynecological procedures were associated with significantly low risk of developing chronic post-surgical pain. So, what are the mechanisms for development of chronic post-surgical pain? A nerve injury can give rise to a neuroinflammation and immune reaction. This will lead to release of neurotransmitters and an ectopic neuronal activity. Followed by this, you will have altered dorsal horn activity and amplification of your sensory flow, which eventually gives rise to the central sensitization. Let's talk about the post-thoracotomy pain syndrome and the various causes. Damage to the intercostal nerve is one of the important factors. Tumor recurrence can give rise to post-thoracotomy pain. The type of the incision also gives rise to the chronic post-surgical pain. The other factors which are responsible are personality traits. Pre-op anxiety is associated with a large increase of development of chronic post-surgical pain. Costochondral and costovertebral dysarticulation, as well as rib retraction and ipsilateral shoulder disability, are also associated with the post-thoracotomy pain. So thanks very much. This was a part 1. We will discuss about the treatment strategies in part 2 of this lecture series. Please kindly subscribe to our YouTube channel, Pain Guru, or you can visit at www.painguru.weebly.com. Thank you.